Welcome to the Allied Health Professionals podcast series
with your hosts, Jennifer Trafford
and Alison Kerr.
So today's podcast, we have some special guests in from our therapeutic radiography team, which makes me the only non-therapeutic radiographer in the room.
Yes, so today we've got our guest speakers. We have
Rosie Robinson, Danielle Clydesdale.
It's great to have you on our podcast series.
Thank you.
So I'm a therapeutic radiographer by background as well, so I feel like I'm in good company. But you tell me just a little bit about what's it like to be a therapeutic radiographer?
It's a really rewarding career, actually.
Absolutely,
We both love our jobs. We have quite a lot of variety in our jobs every single day, don't
Definitely,
we?
yeah.
We get to really make a difference to people's lives. We'll talk a little bit about that, about what we do, go into a bit more detail. So for those of you who don't know, therapeutic radiographers are allied health professionals who deliver radiotherapy treatment predominantly to cancer patients. So we work in outpatient departments, within a hospital setting, and cancer patients will come and see us on a daily basis and have radiotherapy treatment with us. So we use ionising radiation to target at tumours inside the body, with the view to looking to cure cancer patients of their disease.
Yeah, so a lot of people don't know about radiotherapy. They tend to, if they've had a family member or a friend that's had cancer treatment, they tend to know about chemotherapy. Radiotherapy is kind of, as Rosie was saying, a localised radiation treatment. We specifically pinpoint the tumour. We do CT scans to verify that tumour positioning, and then we deliver the radiation treatment that's been prescribed to that patient.
We're also involved in sort of caring for the patients to help manage any side effects they might get from the treatment as well. So we have sort of a very hybrid role of caring patient profession, but then also quite technological, science-based, a bit of biology, anatomy, and also a little bit of physics as well, but that's not everybody's cup of tea, so we understand that. It's a great balanced job between, like I say, patient care and technology and things like that.
So obviously you're working quite heavily in oncology. All your patients you see have got cancer. Is there any? Do you see the way that the technology is developed, and how is it working? What's it like for your well-being and for the staff's well-being to work in such a high-pressured environment?
Well, I think you might think that we come to work and we do treat cancer patients. We see that day in, day out, and that might be quite scary, sad, challenging, and it is all. It can be all those things, but it's an incredibly positive place to come to work.
Absolutely.
The majority of our patients that we treat, have very great spirits about coming for treatment, and I think coupled with amazing care, they do really, really well, don't they? And so it's actually a really positive place to work, and we can see the difference we're making to people's lives. With the technological advancements we've had over the past, decade or so with radiotherapy, we actually find that most of our patients can walk into the department, have their treatment, and with that accurate with how we do things with the technology that we've got, that patients can't see or feel a thing. They, their side effects are kept quite to a minimum, and they're able to carry on their normal daily lives, go to work or look after their children. It's not always the case. There are some more complex situations where we do need to provide a bit more comprehensive patient care, but generally speaking, patients come and go and they have the treatment and they tolerate it really well, don't they?
Yeah, so the machines that we use are called linear accelerators. So they're the radiation treatment machines, the radiotherapy machines. So as therapeutic radiographers, we run them. We also have to decide the positioning that we get the patient in each day for treatment as well. And to do that, we also run the CT scanners. So the patient will have a CT scan. We will kind of decide the position that the patient needs to be in every day to be able to reproduce for their treatment. They'll then come for their treatment, and we will get them on what we call the treatment couch and basically replicate that position. And we do that in lots of different ways. There's lots of different techniques and things we can use now to make that as accurate as possible. And we also, which we'll talk about a little bit later, but we use things like tattoos to get the patient in the same position every day. And then what the linear accelerator can do is it can do a mini CT scan or X-ray pictures to verify the patient's position. And then we go ahead and deliver the radiation treatment that's been prescribed.
And for the patient side of it, when the patients come into the room and they see this massive machine and they're dealing with the radiation, what do they often say? How do you comfort them to know that everything's going to be okay and that they're safe?
So we have an initial sort of conversation with patients before we ever do any treatment, just to sort of answer any questions they might have. They might have an opportunity to come in and actually see the treatment machines as well. I think a lot of patients sometimes worry it can be a little bit claustrophobic, or if they're having particular bits of equipment they need for treatment. So when we're treating sort of anywhere in the head and neck, they might have a mask made that helps immobilize them, keep them still. But that can be quite claustrophobic and quite daunting. So we often do a lot of coaching with them, talking them through the procedure, showing them so they know what to expect. But yeah.
Yeah, I was going to say, a lot of the patients when they come in at first, they think the linear accelerator looks a bit like a spaceship because it's so big, and I think it's something they've never seen before. A lot of patients have come to us and already had, say, an MRI scan or a CT scan, which we call them the donuts. So you go in and out of the donuts, and can be quite claustrophobic. Whereas they come and see this linear accelerator with all the bright lights, and they do think they're going into like Star Wars or a spaceship. But it's very, like Rosie was saying, it's very open. The room is a big room. The machine rotates around them. They don't feel anything. So a lot of patients come out of having their first treatment and go, "Was that it? Is that all?
There's not much to it.
There's not that much to it." And like you say, it doesn't cause them any sort of harm or initial sort of side effects, which is quite reassuring for a patient.
And as I mentioned earlier, they don't feel anything, they don't see anything. You know, if anyone's had sort of an X-ray to a broken bone or a CT scan or anything, it's very much the same in the sense that you can't see the X-rays that we use, and it's completely painless for the patients as well. So
you don't glow in the dark then?
No, definitely don't.
Unfortunately, yeah, that'd be cool.
And you're also not radioactive as well, which we get a lot. So you get a lot of people coming in saying if their family members go near them, they'll explode. That definitely won't happen. No. It's not like that.
Yeah, you won't unfortunately turn into the Incredible Hulk or another superhero from radiation exposure.
And we don't either. So that's great.
No, exactly.
Yeah. We don't say that to the kids though when we go to do career events.
No.
Everyone wants to know about Spider-Man, and the spiders are huge though.
Yeah.
The spiders in radiotherapy are massive.
Yeah, and the flies, huge.
Yeah.
Should I be worried about this?
So if you could get a message, because obviously a lot of people won't really have gone into radiotherapy before or anything. Is there any interesting or funny stories or anything you'd like to share that's a little bit different that people only on the inside would maybe?
Yeah. I mean, I mentioned before that we obviously have quite a lot of knowledge about anatomy, and we deal with scans, and we're looking at the insides of patients to be able to localise for treatment and assess. So you see all sorts of interesting things on patient scans. Definitely. And making judgment calls. I mean, it wasn't that long ago that I had a patient who had, I think it was like gunshot shrapnel in their abdomen from years ago, from when they'd served in some form of war. They didn't know it was there, and it wasn't until they'd had their preliminary scanning and things, and then we were seeing it every day on treatment. Just these bits of gunshot in their body, exactly, or just strange things like that. It's just.
I think the one thing that I quite like to tell, especially if you go into careers events and things, is that we are like tattoo artists. So you would never think in a career in healthcare that you would be tattooing people, but we do that. And the reason we do that is once we get them in their positioning that we need to replicate each day, we put tattoos on the specific area that we're treating. So for example, if it's the pelvis or the chest, we'll put they're only size of a freckle, they're very small. But as therapeutic radiographers, we do that. And I remember coming as a first year student, couldn't believe that I could actually tattoo a patient. Can't do any smiley faces or butterflies, though, unfortunately.
But they get you practicing on fruit when you're training.
Yeah.
I think whatever someone didn't eat for lunch, because I was on an orange, someone else was on a banana, and just whatever they had in their lunch bag.
Yeah. Banana doesn't hold up too well.
So you talk there about being a student.
Yeah.
Yes.
So from the prospect of people who are thinking about coming into the career pathway, what can they expect if they come to you as a student?
Yeah, so we do have a cohort of undergraduate students who train with us. There's also some apprentices we have in the department as well. And it's generally speaking a 3-year degree programme, isn't it? That's the most of our workforce come through that at the moment. And as I say, with a degree apprenticeship route as well, and also MSc study. But we find that the students are based provisionally on placement. They obviously do academic study as well, yes, but they are mostly with us learning the skills of how we do what we do, the rationale, applying sort of the theory that they learn at uni to what they have in practice, and they become part of the team, don't they?
Absolutely,
that they really do integrate into the department and actually get an opportunity to make such a difference to the patients' lives, chatting with people in the department. Sometimes the bits that we maybe don't get as much of an opportunity to do when we're treating patients and things are able to provide that extra additional support to patients that's really, really valued. So they're definitely part of our radiotherapy family, the students that we have. And we're really fortunate that we've been able to keep on a lot of our students in past years.
Definitely, yeah.
To stay with us in the department that have trained, and that's really great for them, and it's great for us. So,
and it's also nice that we as a department want to support our students, so we now have a nice team of practice educators where we see them through their first, second and third year, and support them through their clinical experience, kind of emotionally as well when they're going through kind of their studies and stuff at university. It's really hard to have that nice support system in the department as well for them to come to us.
Yeah, it's quite a daunting thing to be away from home, I think, potentially, if you're not necessarily local.
Absolutely.
And then doing something that can be emotionally challenging, such as working with poorly patients and cancer patients. And yeah, it's great that we have, you know, that team within the department that can build that rapport.
Well, we've all been the students. We all know
how it feels, exactly, and we know the trials and tribulations to do with it, but also we know that we're on the other side of it, and it's a very, very rewarding career to get into, and there's a lot of opportunities as well. So it isn't just, you know, me and Danielle are predominantly treatment floor radiographers, which means we're the ones who deliver the radiotherapy treatment, but there are other branches of therapeutic radiography. You know, you can become an advanced clinical practitioner that specialises in certain cancer sites, and go and train to be a review radiographer that helps predominantly with side effect management, etc. There's so many different offshoots of therapeutic radiography that, you know, there's just different opportunities.
Yeah, absolutely.
Now that fascinates me, because obviously not being a therapeutic radiographer, and until I came into the role I'm in now, I'm going to be honest with you, I didn't know much about you guys, and I just thought that all radiographers were radiographers. I didn't realise there was a different branch of radiography.
Yeah.
So how did you find out about therapeutic radiography, and why did you choose that over diagnostic?
For me, I actually trained to be a therapeutic radiographer as a postgraduate. So I did like an MSc level qualification. So I already had a biology degree, and I'd done a lot about oncology and cancer biology in my first degree. And it was that, you know, radiotherapy was introduced as a treatment technique. And I thought, okay, I fancy a bit that maybe. You know, I never knew I wanted to go down like the full nursing, working on a ward kind of thing. But I like the idea of working with people, making a difference in a hospital setting. Came across that as being very half hybrid technology and science and patient care. So I thought, do you know what, I'll visit my local radiotherapy centre, spend a day, and really enjoyed it. And I love the fact, I think, you know, we don't want to pit them against each other, but a lot of us like the fact that we get to see the patients every day they come for treatment. You're potentially going to see a patient for up to 7 weeks of treatment, and you really do build that relationship with them and their families, and provide that ongoing support. And I like that a lot.
Absolutely,
about my job.
Mine was a little bit different actually. So I just had experience with like a couple of family members and friends who actually had cancer when I was a lot younger. And a specific friend I remember had to go to America to have something called proton therapy. And I totally did not understand why he had to travel all the way to America to have this treatment that was going to save his life. And it was only from when researching I realised proton therapy wasn't available on the NHS at that point of time, which it is now, but it wasn't when I was younger. And actually proton therapy is a type of radiotherapy treatment. And that's how I kind of learned to know about radiotherapy. When I went into college, same as Rosie, I knew I wanted to help. I knew I wanted to make a difference in people's lives, but didn't necessarily want to go down the nursing route. And it's when I did some work experience, I did it in both. So I did it in diagnostic and therapeutic. And it was the same with therapeutic, of that you can see a patient every day and really get to know a patient, and you're making a difference in a cancer patient's pathway. It's so important. But the one thing I would stress is work experience is the most important thing. I mean, me and Rosie do a lot now in careers and going to colleges and going to schools and talking to people, but I think you really have to come into a department and see, would you fit into this role? Would it be something you'd want to do for a lifelong career? And that's why I can't stress, like, work experience is so important.
Definitely.
Yeah.
But if anyone's considering, you know, that this might be something that sounds like a bit of them, just, you know, reach out to your local radiotherapy centre and even go, you know, for a few hours and just see it with your own eyes. Also, a lot of centres do open days, so we run an open day here, you know, once or twice a year, and you can go with your, you know, parents, careers advisors, students, and anyone looking for career change. You know, look out for these advertisements and go and see your local radiotherapy centre at an open day, and see what you think.
So, moving on now, what advice would you give to people who want to come in, and what's the little tidbit of information you'd give, knowing that you've been in your careers quite a while now? What advice?
Me too. Yeah. I think I want to touch on what I've just said previously. So if it is something you are interested in, is healthcare or working in a hospital, but like you say, at the minute, in general, you think, oh, it's being a doctor or a nurse, they're my two options. It's to really get out there and look at the different options. I mean, things like this podcast is look at what allied health professionals are, look at the different career opportunities in a hospital. obviously we're going to big up the therapeutic radiographers because they're the best. But what I would say is get to your local hospital and do some work experience, come to the department, get to meet us, meet our team and see what we do on a day-to-day basis. And it's important to stress that once you get a career like a therapeutic radiographer, I always say like the world's your oyster. Like there's so many different opportunities now to be able to progress. Me and Rosie, obviously we do look after our students, so we're what we call practice educators. But also I'm massively kind of into promoting the career and getting out to schools. That's something I never thought I would do when I first qualified. I thought it'll just be treating patients. No, there's so many opportunities in your career, and I think it's important to get out there and see what there is.
Definitely. I think that as well, it's bearing in mind that radiotherapy is such a rapidly advancing field, and even in our lifetime, there's going to be so many more advancements, introduction of sort of artificial intelligence and things like that, and how we can make the outcomes better for our patients and for us as staff as well, and in terms of how we provide care. And it's just the opportunity to be involved in such a rapidly developing technology where you're always able to be challenged. No 2 days are the same, and really hone in on your problem solving skills and analytical skills and that kind of thing. It's a very stimulating job in that respect.
And I can't stress enough the feeling when you see a patient finish their treatment and ring the treatment finish bell, what it feels like, especially when you've tracked them every day for up to, like Rose said, 7 weeks. It's the most rewarding feeling that you can have.
Definitely. Yeah, it's nothing like it.
Can I say, ladies, your passion for your profession absolutely shines through. And it's been an absolute privilege to spend some time with you and to hear more about what you do and what you bring to our patients and to our NHS. It's just amazing what you do. Thank you so much for your time. We really appreciate it.
Thank you for having us.
Yeah, thank you very much.
If you need any further information, you can email alison.kerr13@nhs.net.